In our first responder kit that comes with our AED, we have a pair of scissors, a razor, some woven sponges, an antiseptic wipe, a pair of gloves, and a CPR mask. When you do have to use the AED, you're going to have your unit, and then you'll also have your person that's suffering from the cardiac arrest or whatever the event is. What you're going to do is you're going to turn the unit on.
Begin by removing all clothing from the patient's chest. Cut clothing if needed.
You would use your scissors at this time, or the razor, to clean up the patient and cut the clothing.
When patient's chest is bare, remove protective cover and take out white adhesive pads.
We're going to pull the unit.
When patient's chest is bare, look carefully at the pictures on the white adhesive pads. Peel one pad from the yellow plastic liner.
So you see the locations on the pads.
Look carefully at the pictures on the white adhesive pads. Peel one pad.
At this point, we're going to
When the first pad is in place,
the pads on.
look. No one should touch the patient. Analyzing. No one should touch the patient. Shock advised. Stay clear of patient. Press the flashing orange button now. Shock delivered. Be sure emergency medical services have been called. It is safe to touch the patient. Begin CPR. For help with CPR, press the flashing blue button. Place the heel of one hand in the center of the chest, between the nipples. Place your other hand on top of the first. Push the chest down firmly 2 inches. Keep